I'm here to basically show you how we at the City of Toronto leverage the use of the data. And when we started to work with 211 data, the first thing we realized as social service providers that we needed, as some people have said in the audience already, an additional source of data that would help inform in our decision making. And that's basically where it took off. I remember the first meetings that we had with Find Help Toronto at that time was, can we get access to your data? We want to use it for our service planning, and that's where it started. So I'm just going to show you a couple examples of how we do that in the City of Toronto. The importance of 211 data for social research. Then I'll go into the case study and a couple of examples of how we've used the directory of human services data for planning at the City of Toronto. And finally, I want to give you a quick 1-minute demo of Wellbeing Toronto. It's a web-based mapping system that allows you to call up community and health indicators at the neighborhood level, including social service information by neighborhoods in Toronto. So I just want to show you that because 211 data forms an integral part of that new web-based mapping system, the City of Toronto. Well, 211 data is definitely a hub. It's a hub that helps us in all of our decision making at the City of Toronto. It helps us in many different ways. It does provide that factual set of data that allows us to defend positions, to look at options. We now live in a new environment in government. It's all about accountability, and it's all about how well are we doing with the services that we provide, and are they making a difference? All of that requires data. And we've managed to use that data in the overall, in the end of this slide, the evidence-based decision-making. That's the mantra. And we've used this 211 data as a standard. Before this, everybody would have a different definition of the human services sector. Some people would define it this way. Some people would define it another way. We decided to simply take the definition and assume the definition is given to us by 211 and use those standards as the de facto definition. That way we have comparability across all of Canada. I mean, I think that's the idea. So the 211 data, how does it help inform social issues? It does provide a standard. Bill talked about the AIR standard and some of the taxonomy. It also provides a standard in terms of what's included in our definition of human services. The important thing to note, too, is that as the system has evolved in Toronto, we as service providers at the city also provide information back to 211. So the city operates childcare, it operates homeless shelters, right? And operates long-term care. So all of our information also gets fed back into 211 in terms of what we consider to be the most updated list. And through their editors, they then come up with this unified list of the comprehensive environment of human services. And that's, I think, the value of it. It's truly a collaborative in keeping the information up to date. I'm not going to go through this slide in detail. Suffice it to say that since the mid-90s, we've been working with 211 data. It's been an iterative developmental process, nurturing agencies' cultures, convincing them of the value of the data, and moving in steps in making sure that the data is quality data. So I'm just going to summarize this one way, in that from the 90s, it came as a conceptual idea to take 211 data for decision making. Over the years, we've developed a series of detailed MOUs, service level agreements with the City of Toronto and Find Help Toronto. So much so that even towards the late 90s, we involved INT. So what became an impetus of a concept was now cemented into a strong SLA where we would pass data between servers. So for example, if you go to the Toronto 211 site, there's a little map tool there. That mapping system's actually situated on City of Toronto INT infrastructure. The data is passed weekly. I think it's like 4 in the morning on a Friday. It gets automatically geocoded, puts into the city's GIS information system, and that is integrated with the 211 website because they don't have the capacity to do that online mapping. We do. So it's a shared resource to get that information going to the public. There are basically 5 bubbles, the way that we integrate data at the City of Toronto. The red one at the top is 211 data. The other areas of data for us at the city that help with social service planning are our own data in blue, the municipal data, that's our administrative data sets, caseload data from our shelters, from childcare, so on and so forth. The green one down in the lower left, other government data, such as the national census, community data on the right in the yellow through surveys that we do in the community. And the one in orange, I'm just going to touch upon. There's actually another session, I think it was yesterday, on the National Data Consortium. So we're a part of a consortium of 24 member municipalities, and that information is also integrated with our GIS systems. How do we use the data at the City of Toronto? Well, this is pretty well basic 101 social services planning for you folks in the audience. Toronto is a mixed service delivery system. We deliver social service systems, as does the community. What I want to show you, though, is how we use the 211 directory service for the following. Internal service planning, for you planners out there, site plan evaluation, environmental assessments, information for politicians and decision makers, very important. Emergency planning, community partnerships, and social policy. So on to the first one. These are just a couple of samples of maps that I cobbled together. I just sent this in yesterday, so if there's any errors, let me know. But these are some of the work that we do in terms of environmental scans. The basic thing that we use agency-level data for is what is out there in the community in terms of the human services infrastructure. These two maps show our revitalization areas in the City of Toronto. The one on the left is Jane Finch. The one on the right is Regent Park. And when we first started on these redevelopment initiatives, the big question asked by council was, what's in these communities? So we used the Blue Book to figure out where were all the childcare, toy lending libraries, food banks, and so on and so forth, to do outreach, to do environmental scanning. We use it also for internal service gap planning. I've heard that term just with the questions when Bill was presenting. And for geographic, where are all the gaps in services in the City of Toronto? We actually maintain a snapshot of all of the 201 directory service data since the mid-90s. So while the referral system drops the data, we keep snapshots of it. So we can actually see the nature of the human services system as it existed in the 90s and the way it exists now. And the map on the left, for example, is one we just did where we wanted to see how the system has changed from 1996 to 2008. It's hard to see, but just the theme of it is where certain agencies have been removed from the picture for whatever reason. They either moved or they integrated with other agencies or what have you, and areas where agencies are now setting up, mostly in the suburbs, as they meet the trend of family formation in the outer areas of the City of Toronto. The one on the right here is where we got a request from a councillor who was concerned about Chinese services and that they were not meeting the needs of the Chinese community. So we actually took an extract of the service data in yellow, which is basically the 201 data that provides services to the Chinese community. Underneath that purple tile map is the census data on recent immigrants of Chinese from China. And what we found is, although it seems as if there's a match, when you look at the data fields in 201 data, you begin to see that there is a mismatch between the types of services given to a certain dialect, like Mandarin and Cantonese, and where those people were settling in Toronto. And there very much was a maldistribution where most of the traditional services were servicing the Cantonese population, but the emerging data in the census showed that there were emerging communities in Mandarin in the outer areas, and that it was not keeping up. And that's important for our service providers to know. That's important for our grants unit to know, so how they can better understand the communities and where grants should go. Because as you know, with many different dialects, I speak Cantonese, but if you spoke Mandarin to me, I would not understand a word. So it's very important to note those distinctions. Just as I breeze through this, I'm going to let you know about a few other little things that we did with the service data. This is the 201 locations in 2008. But what we've done here is we've layered, the red dots are essentially a subset of the data that provide information on the immigrant settlement sector. So you can take the directory of service data and cut it many different ways. Much like Bill showed you on how he can dice and slice the call center data, we can dice and slice the service directory data as well, based on those taxonomy terms. So they're consistent terms. And when we do a subset of the immigrant settlement sector, we can do the same for youth, seniors, so on and so forth. This one's where we took that information on immigrant settlement services and we matched it with census data, but this time the grants area of our offices were interested in which communities were predominantly one large ethnic group, which other communities were many different slices of groups with not one predominating, if you follow. And all this really shows you is that the purple areas in the City of Toronto are where there are many different groups. There's no one group that predominates. Whereas the red ones, there is usually a singular ethnic group that does. Now that might be important for research to know, but it's even more important for service delivery like grants, people to know where their grants dollars are going. And again, it's all about that slide I talked about, the mantra of evidence-based planning. We need to know where our dollars are going, and we need to have evidence to tell us how to get there. Same thing, this one's just looking at now the supply and demand analysis of recent immigrants again, and the immigrant settlement in blue, which is 211 data. This one is even more granular, where the information is at the block level from the census, showing where the concentrations are of recent immigrants. Now we're getting into site plan evaluations. This is something that we didn't do in the social human services cluster, but planning does. So we send them templates of the data every time they do an official plan amendment, secondary area plan. They need to know what types of social services are in that area. In Toronto, we call them community facility studies. They do them, and it's pretty quick. They send us a boundary, and we cut the 201 data and we send it to them. It literally happens in about 10 minutes. And then they insert these into their committee and council reports. Information for politicians and decision makers at council. We occasionally do these little directories for them, especially when there's a new council coming in. We have a little briefing package, and at times we've included this information in the briefing package. And so those blue dots are essentially your 211 data in those wards. Emergency planning, where we do the planning at the mapping at the City of Toronto for G20 and emergency planning, and we use the 211 data for outreach. So this is just an example of that. And you can see that the symbols are color-coded by type. And again, we do that through looking at the various definitions and categorizations of the 201 data in order to do that. Community partnerships, this one's with University of York, where they decided to do a long-term study to look at immigrant settlement patterns in the GTA. We supplied them with the endorsement of 201 Toronto, not only census information, but directory service information. They did this study that showed the trends in demographic change and in service clustering. Social policy, I mentioned the Strong Neighbourhoods Task Force because I believe the lady at the back had a question about United Way. 2005, Year of the Gun in Toronto, established what we called a Strong Neighbourhoods Task Force. That task force was made up of the City of Toronto, all the other levels of government, provincial and federal, as well as the United Way. It ended up in a long way of identification of priorities in the City of Toronto. How do we come up with those priority areas? You can come up with them many different ways, politically, or you can use research and data. It was actually the latter that we used to come up with our priority areas in the City of Toronto. These two maps show where there's basically gaps in services. In other words, where there may be a large concentration of population need, whether it's immigrant settlement, youth, what have you, but very few services for those subgroups. Now, I'm saying this all in one sentence, but there was a long one-month methodological process to do that, where we compared 201 data at a very detailed level and where they were located using GIS techniques, and block-level data and where clients from census were located in order to do this gap analysis. And the map on the right, in summary, you see those little red areas. Those red areas are where there are absolutely no services for concentrations of population subgroups. It should come as no surprise that there's one there that's Rosedale, so I don't think they need social services, but it shows you that the model's actually working. We also applied social risk indicators, low income, single parent families, those things. We layered that with crime rates, and we came up with the city's 13 priority areas. So 201 data was very much a part of that. We do use call center data. We did use it for our understanding of people's needs, and this is basically what we use at the City of Toronto for some of our council reports. And Bill's covered off a lot of this. So you can see some of the major pieces: City Strong Neighbourhoods Task Force, Regent Park, Lawrence Heights redevelopment. Prevention Intervention Toronto is the city's new youth gang intervention strategy. We use the 201 data for that too, because we work with the police to identify areas in the city where we would target our youth intervention programs, and we use the 201 data for outreach. Community partnership strategy is the new city's blueprint for human services planning. It's in progress right now, will be released next year, and it too is using 201 data to understand the communities that we're in. So when you get to the city website, it's in the presentation. Just go to the city's website and just do a search on Wellbeing Toronto, or you can Google Wellbeing Toronto. This basically gets you to our new mapping application. Like Bill said, we don't do a lot of advertising around this. It's not our business, but we did just launch this 2 months ago. I'm just going to show you the 201 aspect, but basically it's at the neighborhood level in Toronto. It allows you to call up a variety of different information about a community. And as you see, I scroll over and it tells you the population, children, youth, so on and so forth. Let's see if I can move over to this screen is, it also gives you detailed graphs about in this case, I'm choosing population as a default. You can do everything from low income to even locations of where the 211 data are through these maps. And I encourage you to just play with this thing to show you how it works. Over here, let me just show you a couple of things. I'm going to just pick a demographic indicator, and I'll choose, I don't know, I'll choose seniors, 80 to 84. Now, what will happen is that map will change dynamically. I can zoom out and you can see where the concentrations are of seniors, but I'm not here to show that to you. Over here under the display tab, if you go down, we actually have a variety of services that you can call up as reference layers. Okay, public health, supermarkets, churches, so on and so forth. We do have find help data here, and if I click on that and I go back over and scroll down, you'll basically be able to see not only where the concentrations of seniors are, but you'll be able to see where the locations of social services are in those communities. So let me just scroll down because this screen's a little bit small. And as you get closer to the ground, dots will appear. Now, we're doing this in a staged implementation in that we respect the fact that there are licensing agreements on the release of the 211 data. What we've reached an agreement to release this data in an incremental basis. This information is now public. The next phase is that we'll be releasing the 211 data where you'll be able to call up when you hover over the information what that service agency is. Since we just launched this, all this really is the locations of the service agencies as dots and location points. We should have that information when you scroll over for looking at in terms of the name of that agency probably by January. Let me just turn this off. You can see how detailed it is. Now, the reason why there's no 211 data popping up is because I'm right in the middle of a residential area. It's one of these things where I just clicked it. But suffice to say, if I back out, it'll basically show you that there's everything that you can call up from 211 data to so on. Let's see if I can just back out enough that you can see some of this stuff. This is, there we go, there's some there, right? There's a green dot there. Again, we're in the midst of a residential area, but you'll begin to see, I don't want to spend too much time on this, just play with it, right? We do have everything in here from police stations, and we're loading indicators on health from the city, so the MIN database, remember that slide I showed you all those bubble diagrams? A lot of the data for this system is also coming from our administrative data sets. So from social services, caseload data, we have police crime data, health data. We just loaded diabetes rates. They're all at the neighborhood level aggregation, with the exception of the 211 data, which are point data. And again, next phase will be allowing people to view that data in more detail.